of the managers here at the Northwestern Transplant Program. I'm going to be going over some important key concepts for liver transplant recipient candidates. All right, transplant procedure. So your transplant physician and surgeon will determine your need for a transplant. Technical aspects are discussed in the What You Need to Know About Liver Transplantation video. If transplant is right for you, it has the potential to increase your life expectancy and or stop your current treatment. How surgery will affect the recipient is explained in the What You Need to Know About Liver Transplantation video. Recipient hospitalization and when daily activities may be resumed is determined on an individual basis. There are risks to evaluation and transplantation, including general and organ-specific risks, as well as surgical, medical, psychosocial, and financial risks. Please see the What You Need to Know About Liver Transplantation video. Follow-up appointments after transplantation will be given to you at the time of discharge. So deceased donors have a chance of carrying infection through all deceased donors, although all deceased donors are screened for risks. There also may be disease found after transplantation. Your team will let you know your specific organ donor risks at the time of an organ offer. So there is no comprehensive way to screen deceased donors for all transmittable diseases and organ donor risk, and they include but are not limited to DCD, ECD, hepatitis A, B, C, malaria and HIV, and other known conditions that may be transmitted by the donor organ. Deceased donors are evaluated and screened prior to transplantation, and malignancies and diseases may be identified and transmitted after transplant. Results may impact post-transplant evaluation, screening, and management of the candidates. Your transplant team. That includes transplant physicians, surgeons, social workers, the nurse coordinators, pharmacists, and registered dietitians. Indications for transplants are discussed in the What You Need to Know About Liver Transplantation. Deceased donor versus living donor is discussed there. Recipient responsibilities include but are not limited to a medical and psychosocial evaluation and other testing performed at Northwestern Memorial Hospital. Return to NMH for scheduled follow-up according to policy. And transplant program responsibilities include but are not limited to completing the evaluation and informing the potential recipient of all results, making a decision about the potential recipient based on the program's written selection criteria. The evaluation and listing process continued as Northwestern will do a medical, surgical, financial, and psychosocial evaluation using Northwestern selection criteria. Sometimes recipients need to complete a re-evaluation if too much time has passed or additional information is needed. All evaluations are brought to the multidisciplinary selection committee made up of the transplant team members. Listing process, waiting time, multiple listing, UNOS allocation, MELD, and organ types are all discussed in detail in the What You Need to Know About Liver Transplantation video. After approval, non-compliance or not adhering to your plan could result in your removal from the waiting list. The absence of a transplant surgeon or physician may impact a transplant candidate's ability to receive a transplant if an organ becomes available. A transplant surgeon is always available 24/7 to take organ offers and perform organ transplantation surgery. But if something catastrophic happens and the program cannot transplant patients, we will inform all patients on the waiting list. Immunosuppressants and medications. There are risks to taking medication, and that medication is needed for your entire life. Risks may include infections and malignancy. There are side effects of all medications that your team will review with you during your evaluation. The cost associated with your medications will depend on your insurance and will be determined then. Your transplant physicians will inform you of any immunosuppression medication research protocols. After an organ transplant, it is possible a patient may reject the organ. Oftentimes it is treatable, but it could lead to graft loss in some cases. Please see the What You Need to Know About Liver Transplantation video for more details. Part of the evaluation includes ensuring insurance will cover your transplant and personal costs associated with transplants. We need to evaluate future insurability and ability to pay for medications lifelong. The fact that if the transplant is not provided in a Medicare-approved center, it could affect the patient's ability to have his or her immunosuppressive medications paid for by Medicare Part B. Risks, including but not limited to inability to obtain insurance coverage for future health problems related to transplants, eligibility for medical, disability, and life insurance. The Scientific Registry of Transplant Recipients is used to show potential recipients a transplant center's one-year graft and patient survival. The website for SRTR is www.srtr.org. If you have any questions about the SRTR website, please ask your assigned transplant nurse coordinator. There are early and late causes of graft failure, and that is why it is important to be compliant with your medications and follow up with your transplant physician. Alternative treatments. Alternative treatment options are discussed in the What You Need to Know About Liver Transplantation video. Potential recipients can't withdraw at any time during the process, and your transplant nurse coordinator will explain how the waiting list works, when you need to follow up, and what happens when an organ becomes available. Living Donor Liver Program. Details can be found in the Living Donor Education video. Thank you for watching. If you have any questions, please bring them to your clinic appointment. Thank you.